Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 15 practice questions. Without the way, let's get started.
A nurse manager considers that there are the rights of delegation, which is a right of delegation in addition to right task, right person, right communication, and right time. 1. Place. 2. Route. 3. Feedback. 4. Supervision. The correct answer is for supervision. Rationale. The one who delegates a task is responsible for ensuring that the task is performed safely and according to standards of practice. The right place is not one of the rights of delegation. The right route refers to the rights of medication administration, not the rights of delegation. Feedback is part of communication, which is one of the rights of delegation already cited in the stem of the question. Which should the manager do first to overcome resistance to change? 1. Ensure that the plan change is within the current beliefs and values of the group. 2. Provide incentives to encourage commitment of participants to the change. 3. Implement change by employing small steps rather than large steps. 4. Use influence power to ensure that goals of change are met. The correct answer is 1. Ensure that the plan change is within the current beliefs and values of the group. Rationale. Change that is consistent with current values and beliefs is easier to implement than change that is inconsistent with current values and beliefs. Values and beliefs are difficult to change. Option 2 is not the priority intervention. Although incentives might motivate some individuals, they do not motivate all because some people have an internal rather than an external locus of control. In option 3, although small steps are more effective than large steps because they are easier to achieve and once achieved, are motivating, this approach is not the first thing the nurse should do to overcome resistance to change. In option 4, although one person sharing explanations with another is helpful when trying to change behavior, it is not the most effective type of power to use when trying to affect change. Several nurses complain to the nurse manager that one of the nursing assistants constantly takes extensive lunch breaks. Which should the nurse manager do? 1. Convene a group meeting of all the nursing assistants to review their responsibilities related to time management. 2. Talk with the nursing assistant to explore the reasons for the behavior and review expectations. 3. Arrange a meeting with the nurses so that they can confront the nursing assistant as a group. 4. Document the nursing assistant's behavior and place it in the aides personnel file. The correct answer is 2. Talk with the nursing assistant to explore the reasons for the behavior and review expectations. Rationale. Recognition of a problem is the first step in the problem-solving process. Once the unacceptable behavior is identified and acknowledged, then the reasons for the problem can be explored, solutions suggested, and expectations reinforced. In option 1, it is the nursing assistant who is late and takes extensive lunch breaks who needs to review the responsibilities related to time, not the nursing assistants who follow the rules. It is not the responsibility of others to confront the employee who is late for work and takes extensive lunch breaks. The employee reports to the nurse manager, who is superior in the chain of command of the organization. The nurse manager should meet with the employee. In addition, counseling sessions with employees should be confidential and conducted in private. Option 4 is premature. The nurse manager first should implement an action identified in another option. Which should the nurse do to ensure efficiency when managing a daily assignment? 1. Give care to a client in isolation first. 2. Plan activities to promote nursing convenience. 3. Organize care around legally required activities. 4. Perform routine bed baths between breakfast and lunch. The correct answer is 3. Organize care around legally required activities. Rationale. Legally required activities must be accomplished because they are dependent functions that support the medical regimen of care. Although legally required activities should be accomplished first, many independent actions by the nurse also must be implemented to maintain a basic standard of care and client safety. Some nursing interventions, which are not essential, can be implemented after the required activities. Client needs are the priority, not the convenience of the nurse. Options 1 and 4 may not be possible, depending on the needs of clients. A first-year nursing student in the clinical area is given an appropriate client assignment by the instructor. Which should the student nurse do? 1. Complete the care indicated on the client's plan of care. 2. Accept the role of leader of the client's healthcare team. 3. Assume accountability for the tasks that are assigned by the instructor. 4. Help other students to complete their assigned tasks whenever necessary. The correct answer is 3. Assume accountability for the tasks that are assigned by the instructor. Rationale. Students are accountable for the tasks assigned by the instructor or preceptor. As part of accountability, students are obligated to keep the instructor or preceptor informed about the status of the client, how the assignment is progressing, and whether all interventions are implemented as planned. Although students are expected to complete all planned care, the client's condition can change or some unforeseen event may interfere with the plan. The student must keep the instructor or preceptor informed about the client's condition and use the instructor or preceptor as a resource person when the unexpected occurs or guidance is needed. Students are assigned to care for clients for a specific time period and generally are included as members, not leaders of the nursing team, particularly beginning nursing students. Students should not help other students unless specifically assigned to do so by the instructor or preceptor. An exception occurs when assistance is needed to ensure client safety in an emergency. When delegating a specific procedure to a client care aide, the aide refuses to perform the procedure. Which should the nurse do first? 1. Assign the procedure to another client care aide. 2. Explain that it is part of the client care aide's job description. 3. Explore why the client care aide refused to perform the procedure. 4. Send the client care aide to the procedure manual to review the procedure. The correct answer is 3. Explore why the client care aide refused to perform the procedure. Rationale. The nurse must first explore the reason for the nurse aide's refusal to perform the procedure. The employee may have an acceptable reason for refusing to comply. When the reason is identified, then the nurse manager can take an informed action. Assigning the procedure to another staff member is premature. Another option has priority. The employee may be fully aware of the requirements of the job description and not need to have them described. Even though a task is within one's job description, a person can refuse to perform a procedure because of a reason that is considered acceptable. Which is the most important reason why a nursing assistant must fully understand how to implement a delegated procedure? 1. Be capable of completing the procedure safely. 2. Be proficient enough to perform the procedure quickly. 3. Have the knowledge to explain the procedure to a client. 4. Have the correct information when teaching the procedure to another nursing assistant. The correct answer is 1. Be capable of completing the procedure safely. Rationale. Safety of the client is the priority. The nursing assistant must perform only the skills that are within the legal role of the nursing assistant and perform correctly on a return demonstration. Nurse aides are trained and supervised by the nurse, not other nurse aides. A nursing team leader delegates a wound irrigation to a licensed practical nurse. It has been a long time since the LPN performed this procedure. Which should the nursing team leader do to ensure client safety? 1. Verbally describe how to perform the procedure to the LPN. 2. Have the LPN demonstrate how to perform the procedure. 3. Assign another LPN to assist with the procedure. 4. Delegate the procedure to another LPN. The correct answer is 2. Have the LPN demonstrate how to perform the procedure. Rationale. Demonstration is the safest way to assess whether a person has the knowledge and skill to perform a procedure safely. A superior delegating care is responsible for ensuring that the person implementing the care is legally qualified and competent. Providing just a verbal description is unsafe. This does not ensure that cognitive information can be converted to a psychomotor skill. A peer should not be held responsible for the care assigned to another team member. The nurse who delegates a procedure to a subordinate is directly responsible for ensuring that the care is safely delivered to clients. Option 4 does not address the original licensed practical nurses need to know how to perform the procedure safely. This procedure is within the legal scope of practice of a licensed practical nurse. A nurse manager is informed that a large number of clients will be admitted in response to a terrorist attack. Which type of leadership style is appropriate to use in this situation? 1. Collaborative. 2. Authoritarian. 3. Laissez-faire. 4. Democratic. The correct answer is 2. Authoritarian. Rationale. The authoritarian leadership style is the appropriate style to use in a crisis when urgent decisions are necessary. In a crisis, one person must assume the responsibility for decisions. Autocratic leaders give orders and directions and make decisions for the group. Collaborative is not a classic leadership style. Collaborative refers to the democratic leadership style. Democratic leaders encourage discussion and decision-making within the group, which requires collaboration, coordination, and communication among group members. The laissez-faire leadership style is not the appropriate style to use in a crisis when urgent decisions are necessary. Laissez-faire leaders are non-directive and permissive, which allows for self-regulation, creativity, and autonomy but limits fast-acting efficiency. The democratic leadership style is not the appropriate style to use in a crisis when urgent decisions are necessary. Democratic leaders encourage discussion and decision-making within the group, which takes time. A nurse manager is experiencing staff resistance when implementing change. Which is the most important action by the nurse manager to overcome resistance to change? 1. Identify the reason for the resistance. 2. Restate the purpose of the change concisely. 3. Modify the goals to appeal to more key people. 4. Emphasize the positive consequences of the planned change. The correct answer is 1. Identify the reason for the resistance. Rationale. Option 1 is essential to overcome resistance to change. There are many different reasons people resist change. Each person will respond to different strategies. There are 4 different types of interventions to overcome resistance: providing information, disproving currently held beliefs, maintaining psychological safety, and administrating an order or command. Although it is important to state the purpose of the change clearly and concisely, another option is a more important action that can be implemented by the nurse manager to overcome resistance to change. Modifying a goal compromises the integrity of the planned change. All ramifications associated with the change should be explored before beginning, and all contingencies planned for, so that modifying a goal will be unnecessary. Although emphasizing the positive consequences of the planned change might be done, another option is a more important action that can be implemented by the nurse manager to overcome resistance to change. A nurse manager plans to provide feedback to a subordinate who needs a change in behavior. Which is the first intervention by the nurse manager? 1. Be assertive. 2. Explore alternatives. 3. Identify the unacceptable behavior. 4. Document the content of the counseling session. The correct answer is 3. Identify the unacceptable behavior. Rationale. Problem recognition is the first step in the problem-solving process. Once the unacceptable behavior is identified and acknowledged, then the reasons for the problem can be explored, solutions suggested, and expectations reinforced. The nurse manager can provide negative feedback that is firm without being assertive. Not yielding under pressure is less confrontational than being confident in a persistent way. When providing negative feedback, the exploration of alternative solutions is performed later in the counseling session. Although documenting the content of the counseling session should be done, it is not feedback. Feedback is necessary for the subordinate to recognize one's offending behavior. In addition, documentation is the last, not the first, step in the counseling process. A client is to be discharged from the hospital. Which discharge task can be delegated to a nursing assistant? Select all that apply. 1. Teaching the client how to measure weight using a standing scale. 2. Obtaining the client's temperature, pulse, and respiratory rate. 3. Determining if the client knows how to measure fluid intake. 4. Demonstrating to the client how to safely use a walker. 5. Reviewing foods that are high in vitamin C. The correct answer is 2. Obtaining the client's temperature, pulse, and respiratory rate. Rationale. Teaching a client how to obtain a body weight requires the knowledge and judgment of a nurse. Teaching requires a complex level of interaction with the client, problem solving, and innovation in the form of an individually designed teaching plan of care that addresses the specific learning needs of the client. In addition, the outcome is unpredictable, and it has the potential to cause harm if the skill is taught incorrectly. Obtaining vital signs can be delegated to a nursing assistant because it is not a complex task. It requires simple problem-solving skills and a simple level of interaction with the client. Although this task has the potential to cause harm if the critical elements of the skill are not implemented appropriately, it is within the scope of practice of a nursing assistant. It does not require the more advanced competencies of a nurse. Assessing a client's level of understanding is a complex task that requires knowledge and judgment and is within the scope of practice of a nurse. This task requires a complex level of interaction with the client, problem solving, and innovation in the form of an individually designed teaching plan of care that addresses the specific learning needs of the client. Teaching a client how to use a walker requires the knowledge and judgment of a nurse. Reviewing foods that are high in vitamin C requires the knowledge and judgment of a nurse. Place the following steps of the decision-making process in the order in which they should be implemented by a nurse. 1. Identify possible solutions to the problem. 2. Gather relevant information. 3. Identify the problem. 4. Evaluate the result. 5. Test the solution. The correct order is 3. Identify the problem. 2. Gather relevant information. 1. Identify possible solutions to the problem. 5. Test the solution. And 4. Evaluate the result. Rationale. The first step in the decision-making process is defining and describing the problem. The second step in the decision-making process is gathering significant information associated with the problem. The third step of the decision-making process is identifying promising strategies to resolve the problem. The fourth step of the decision-making process is implementing an action to address the problem. The fifth step of the decision-making process is evaluating the results by comparing the actual outcomes to the expected outcomes of the employed solution to the problems. A nurse and a nursing assistant are working together on a surgical unit. Which activity should the nurse assign to the nursing assistant? Select all that apply. 1. Taking vital signs of clients who are stable. 2. Delivering meal trays to clients who are in isolation. 3. Explaining to a client how to use an incentive spirometer. 4. Changing the linens on beds that are occupied by clients who are on bed rest. 5. Emptying a urine collection bag that is attached to continuous bladder irrigation. The correct answers are 1. Taking vital signs of clients who are stable. 2. Delivering meal trays to clients who are in isolation. 4. Changing the linens on beds that are occupied by clients who are on bed rest. And 5. Emptying a urine collection bag that is attached to continuous bladder irrigation. Rationale. Taking vital signs of clients who are stable is within the scope of practice of a nursing assistant. Determining the significance of the results of routine vital signs requires the expertise of a nurse. Delivering meal trays to clients who are in isolation is within the scope of practice of a nursing assistant. Nursing assistants are taught how to use personal protective equipment. Changing the linens on beds that are occupied by clients who are on bed rest is within the scope of practice of a nursing assistant. The activity is simple and repetitive. Emptying and recording the volume of output collected from a urine collection bag is within the legal role of a nursing assistant. The nurse will then calculate the volume of urine by deducting the volume of irrigating solution instilled from the total output. Calculating the actual urine output is an assessment that requires the skill of a nurse. Client teaching is within the legal scope of a nurse, not a nursing assistant. Teaching requires a complex level of interaction with the client, problem solving, and innovation in the form of an individually designed teaching plan of care that addresses the specific learning needs of the client. In addition, the outcome is unpredictable and it has the potential to cause harm if the skill is taught incorrectly. The nursing team consists of a nurse in charge, a licensed nurse, and a nursing assistant. Which task should be delegated to a licensed nurse rather than the nursing assistant? Select all that apply. 1. Obtaining routine vital signs. 2. providing discharge teaching. 3. Emulating a stable client in the hall. 4. Transporting a client to another location for an X-ray examination. The correct answer is 2. Providing discharge teaching. Rationale. Discharge teaching requires the knowledge and judgment of a licensed nurse. It requires synthesizing and summarizing information, as well as coordinating a variety of community healthcare services to meet client needs. Taking routine vital signs is not complex, has little potential for harm, requires only simple problem-solving skills, involve a simple level of interaction with the client, and is within the scope of practice of a nursing assistant. Taking vital signs requires the more advanced competencies of a licensed nurse when previous vital signs have been outside the expected range, the client is unstable, or the client is transferred from one service/unit to another. Emulating a stable client in the hall is within the scope of practice of a nursing assistant and does not require the educational skill of a nurse. Transporting a client is not a complex task. It requires simple problem-solving skills and involves a predictable outcome and a simple level of interaction with the client. It does not require the more advanced competencies of a nurse.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.